The daily COVID-19 cases reported in the island have stood above the 1,000 mark for 10 consecutive days. Yesterday, the number of cases reported was 1,331, while the number reported today is slightly reduced to 1,298. As the spread of Omicron in the country is still on the rise, what the health authorities are urging the public to do is to contribute in preventing the spread by adhering to the recommended safety protocols and get vaccinated as soon as possible. Accordingly, by last evening, 5,778,838 persons have obtained the booster dose so far. However, looking at these numbers, it seems that the public seem to be showing some reluctance in obtaining the booster, possibly due to misinformation circling in social media. However, from the 30th of April, the situation will have to be different. As per the new gazette issued by the Minister of Health, Keheliya Ramukwelda, anyone who hasn't completed their required dose of vaccination will be barred from entering public places from the end of April. According to the definition provided by the Director General of Health Services, Dr. Asala Gunawardana, fully vaccinated people over the age of 20 would be those who have obtained the two-dose regime as well as the booster dose. For children between 16 and 19 years, having taken the two-dose regime would render them fully vaccinated, while a single shot would be sufficient for children between 12 to 15 years. With that being the case, getting yourself fully immunized before the 30th of April is important if access to public places is required. Speaking further with regard to the Gazette notification by the Health Minister, the Ministry of Health's Deputy Director General of Education and Research, Dr. Hemantha Herath, referred to this measure as a move to protect both vaccinated and unvaccinated.
Vaccinated person possess a certain level of immunity against the infection, and therefore the likelihood of getting into complications or dying from infection is relatively low for the immunized or vaccinated person. In relation to that, unvaccinated person is more likely to get complications or risk of dying is relatively high compared to the fully vaccinated person. And also because of the high immunity, the vaccinated person's likelihood of spreading the virus is relatively low, and unvaccinated persons, since his immunity is relatively low, the likelihood of spreading the virus into the environment is relatively high. And as a result, we need to protect both vaccinated and unvaccinated persons. To protect the unvaccinated persons, we need to discourage them going into the public places unless it is essential. So therefore, this type of legal measures may help to protect the unvaccinated person.